ERAS application. Everybody must have to complete ERAS application during their US residency application time. But how can you make your ERAS application outstanding among this crowd? In this short video, I will share my top 5 tips for outstanding ERAS application. ERAS stands for Electronic Residency Application Service. I always tell students that ERAS application is such an asset that either you use it or lose it. It is representing you. ERAS application is critical to get interviews and make a strong impression. Remember, once you have submitted your ERAS application, you cannot make any changes besides personal information section. So be vigilant. Number 1 tips. Email address. I will highly encourage you to use a completely separate email address for your ERAS application, because you do not want to spend your valuable time and energy to find out that interview invitation among other thousands email. It will make your life very, very easy, particularly during this application season. Use a professional email address, not like some dramatic name, for example, robinhood@gmail.com. Use your first and last name. That will be preferable, because in this way you are again reminding about your name to your program. Number 2, experience. During that ERAS application completion, you will see that you can include your work experience, research experience, as well as volunteer experience. There will be also a separate section where you can describe your experience. In my opinion, description is vital. Absolutely do not oversell it, because residency program directors as well as faculty will identify it very, very quickly. Keep it between 3 to 5 lines. Make sure you are not keeping your description box blank. This slide is showing SCGME 6 core competencies. These 6 core competencies is very important because every residency program use these 6 core competencies to evaluate their residents during their training. So keep in mind about these core competencies when you are writing your description under that experience. The key question of the experience is that what did you learn during your observership or externship or during your research, or which skill did you develop? You can mention you learned to present the case, which is critically important for any physician. In addition, EMR, like if you used EPIC or Cerner, mention it. If your program is already using that particular EMR and you have used that for few months, at least you are not starting from zero. You have some foundation. This point will go in favor of you. Clinical knowledge through didactics. If you joined grand round, morning reports, noon conferences, mention that. Multidisciplinary rounds, which is very common in the US health system. If you joined any multidisciplinary rounds where you saw that how the physician are working with physical therapy, wound care, social worker, mention that. Use active verbs to describe. Because when you are using active verbs, it gives power to your writing. Let me give you one example. Perform is an active verb. For example, if you are using I perform dash dash versus you mention I did dash dash. See what the power is giving just only changing this one word perform. So absolutely always use active verbs. Some other examples of active verbs are conduct, manage, coordinate. Personal statement. Always keep it within 1 to 2 pages. Nobody has that patience to read one personal statement which is more than 2 pages. This is a perfect opportunity to address any gap or any red flags. We are a human being. We can have any red flag or any gap in our career. However, that does not have to stop us. Mention it in your personal statement. Also include that what did you learn from that challenges and how did you overcome that. Here is one of the key points I would like to share with you, that for some target programs where you find out that your qualifications are matching, personalize that personal statement. I mean that mention that hospital name directly at any paragraph of your personal statement, preferably in the last statement, that you like this hospital and you want to join there as a resident. I completely understand it is not possible to mention your hospital name for every specific personal statement for all the programs. However, select a bunch of them so that it will increase your chance to matching in those programs. One very important point here, that do not send the personal statement which you wrote for X hospital to Y hospital. Be very cautious, otherwise it will backfire. Number 5, spelling, grammar, articles. It may sound very obvious, very easy and simple. Believe me, if there is just only one spelling mistake, the reviewer will already lose that interest from your application. Be mindful. The ERAS application does not include any spell or grammar check feature. Proofread. I cannot stress enough. If you are not sure, double check it. And one more thing. Capitalize your sentence cautiously. Do not use all caps. See, this line, it's difficult to read. First letter of each line should be in the capital letter. Always follow the rule of capitalization. Absolutely no cap all the time. Bonus tips. Showcase your medical school awards mostly in your ERAS application. Be conservative about using your high school awards unless they're extremely significant. Volunteer experience. It does not have to be all medicine related. You are a human being first. Show them you are a dedicated person. You can document if you have any volunteer experience that the community was benefited. ERAS application, use it or lose it. It's absolutely your choice. I wish you all the best for your residency journey. Good luck.